Now we move on. Dr. S. Ramnathan Iyer is present. Dr. Ramnathan Iyer.
Yeah, I'm here, sir. Am I audible?
Yeah, please. I'll just introduce MD, FRCP Glasgow, FICP, FGSI, FISDA, consultant, physician, Mumbai. Wow. Hats off to your academic pursuits. Okay. Yes, please start.
I wish to first thank Professor Bholanath ji for giving me this nice opportunity to interact with so many educational luminaries across the world. And it was just by chance that I told him that what we are looking at now is possibly increasing immunity, because this COVID has taught us to be healthy in spite of so many adversities. So improving immunity, that means we will have to first think about the modern lifestyle, what we are actually, we were going through a very, very tough modern lifestyle. I live in Mumbai. I passed my post-graduation MD Medicine 1978 from Jabalpur. And then I've been doing this working as a consultant in the field of medicine and physician. And I have worked in the rural areas for 14 years as a grassroots physician. I've seen the lot of poverty there, and then coming up and then coming to Mumbai. Then I had the opportunity to get trained in sleep medicine, which is a upcoming branch of medicine, where today the world is actually going to pay a lot of money to get good sleep because of the modern lifestyle. So I'll be focusing certain areas here, and our objective of this talk is to keep good health. So whatever you want to achieve, whatever you want to learn, whatever you want to do in life, first you should have a good health. So my topic is uh, optimizing modern lifestyle for positive health. This is my topic, and I discussed with Dr. Professor Bholanath ji, and he said this will be in tune with our objective in the agenda. And my only issue is that although I am also a professor in medicine, but I teach medicine, I don't teach management. But doctors should be doctors should be good at management also, because we are managing emotions. We are treating we are treating the patients, but the emotional health is very important. And so therefore we are also managers, and we should also be good actors, because you have to act in front of the patients when they are in very bad situation or when they are in joy. So we have to also do like that. So with these short introductory words, I come to my point that this sun has been rising on the east for billions of years, only to awaken us from the world of ignorance. That means when we are sleeping, we are ignorant. When the light falls on us and we awaken us, in the same way, our MTC Global is also awakening us from the world of ignorance on various issues. And I congratulate all the members for having contributed to this nice session. Next one, please. Dr. Bholanath ji, are you operating from there?
Yes, sir. Yes, sir.
Okay, next slide, please. Yeah. Next one, please. Next slide, please.
Yes, sir. 1 minute.
I would like to put up a question why there is an increase in number of patients of lifestyle diseases like diabetes and high blood pressure and heart attacks and related diseases, particularly in last 35 years. Now, earlier in our days, the problem of infection was there, and we didn't have so many patients of diabetes. Now, in today, every third person in our country is possibly having diabetes. And why this sort of a transformation has occurred in our country? And many reasons are there for that, but modern lifestyle is one an important cause. And we should take care of this because it can actually destroy a lot of people who have got good knowledge, but they may be not be in a position to do good work because of poor health. Next one. Next one, sir. Today, the modern lifestyle can be set into two lines. Are we chasing a pot of gold behind the rainbow, or we are having or something called as a rat race? So these two things actually are putting the persons in a lot of mental stress and strain. And plus the COVID pandemic has put a lot of stress on the medical profession also. You know everything about that. This rat race in our country possibly started in 1985. There was a gradual transformation from joint families to nuclear families, and stress was generated. The financial status changed of several people. There are more earnings, and also there was increase in the addictions like smoking and alcohol. I was surprised to know that on the night of 31st of December every year, when the new year is going to strike, there is a queue outside the wine shop to get the alcohol so that they can open it at 12 midnight. So this is something which I have seen it happening. Queues and people are fighting to get the alcohol. Then the behavior change is there. A lot of people have become arrogant. They have become very angry behavior. And so this is also possibly a reflection of the rat race. Next one. Next one, sir. The stress is a very major factor in our daily life. So everybody talks of stress. And in our country, the water scarcity is one of the important factors for stress, because I have seen patients coming at about late night because they say that we are getting water in the evening, so we can't come in the evening. So they come late night. So that affects our life also. There is stress of long daily travel to the places because of traffic jam and everything. There is a problem of irregular diet. There is an economic recession which is always coming and going, and some people are getting good jobs, some people are still suffering. Then the effect of the pandemic causing the economic recession. Then some people are doing overtime work. They are not working in normal hours, but they are doing overtime work just to complete the work. There are some issues over there. There are stress of the daily travel. You can see in Mumbai how people are traveling in the local train. Then there is a burden of education, hypokinetic stress in education. Hypokinetic stress means when people are sitting in the classrooms for hours together. There is hypokinesis and hypokinetic stress. There are areas where there is power shortage. There is lack of playgrounds and parks, and the nuclear families and the elderly care is affected because of that. Next one, sir. And this is a family which I know them from many years ago in Gujarat. I was practicing in a place called Bardoli, where Sardar Vallabhbhai Patel, who was a very great freedom fighter, he did his activities for the freedom from that town. And a lot of people from this town are having motels in USA. And their parents are in here, but the children are having motels in USA and they don't come. But these parents, they just sit like that whole day waiting for the children to come home. And this is called hypokinetic stress. Next one. Then this stress has become a major factor for high blood pressure, diabetes, heart attacks, and sleep problems. And there are also internal stresses inside our system, like the worm infestations, which are there, and they cause stress internally. And the government has launched a worm control program. Now, this is a boy who's carrying the bag on his back. That is, he carries the bag even on holidays, because that is where he is having the balance. This is a cartoon by Lakshman many years ago, and that is the stress of education. Dr. Kuldeep had told that education is going to become economical and people are going to get educated from home. So this will relieve this burden of the bag. Then anxiety is very common today. The people are having health problems. There is a fear of health problems, whether I will get COVID, who will take care, economical issues,
Who?
and you can't resign from
Hello.
life. It is left to fate. Then the depression and all the stress hormones are released in anxiety, and they themselves cause the damage to the body systems. So it's a very complex reaction happening in inside our world today. Next one. Next one, sir. Now you look at the population. Look at the population explosion. India occupies 2.4% of the world land area, and in 2001, when I prepared this slide, it was 1.3 billion, and today it is 1.03 million at that time. Now it is 1.3 billion, and 16.7% of world population we are occupying, and Sri Lanka, Australia, plus Australia population is added every year. So this has to be checked at some point, and we should come back, reduce the population. Next one. Now we would like to talk about the three gunas which are existing in nature. And this exists in all individuals. That is the sattvic guna, the rajas guna, and the tamasic guna. Now we are all aware of these three gunas, and what I would like to tell you that these three gunas operate and dictate what will be the karma, what will be the activity of the person, and that results in the karma, and that has got effect upon the future. So we must identify, and what we should try to adopt here is majority of the guna should be from the sattva, with little of rajas and also with little of the tamas. The tamas will help us to take rest and go to sleep, and some rajasic guna will keep you active and have some ambition in life. But sattvic guna is the best. Next one. Next one, sir. Now, the more you are exposed to the guna, the more that guna will grow in your mind and heart. So expose it to more yourself to sattvic, and the sattva will grow in you. So as I told you that you must have good quantity of the sattvic guna with some little of rajasic guna and also with little of the tamasic guna. The common disorders of modern lifestyle are high blood pressure, diabetes, heart attacks, stroke, that is paralysis, obesity, sleep problems, and psychiatric disorders, which some Dr. Cummins has told about the behavioral problems and whatever psychotherapy excellent work is doing in UK. All these psychiatric problems have now come up. A lot of people are having anxiety and depression, and the suicidal tendencies are there. Then we must attach one more important issue, that is the sleep. It's an emotional issue, and that has got relation to anxiety, depression, grief. And another disease which is also important but not recognized much is the problem of loud snoring, which comes usually after age of 40, 45, but young people can be affected. And this habit of snoring is a prominent symptom of a disease called obstructive sleep apnea. Next one, please, sir. Now, in common sleep disorders of modern lifestyle, the first thing is that the people are sleeping less because they sleep late and get up early. So they lose a lot of the morning sleep, that is the REM sleep, and that is important for cardiac and functioning of the brain and the heart. So, and then they cannot rob time from anywhere except they have to cut down the sleep to get to complete the work. Then they are unable to sleep well. Then snoring, I told you. And this obstructive sleep apnea, if it is there, which is manifested by loud snoring and daytime sleepiness and tiredness, can lead to high blood pressure, diabetes, heart attack, stroke, and several other diseases. Now, waking up early in the morning at 4 a.m. as per the Indian tradition, that is the Brahma Muhurat, to do exercises, religious activities is good, but that should not lead to sleep deprivation. You should sleep at 8 p.m. In my practice of 45 years, I am talking about last 21 years, I am practicing sleep medicine. Nobody is giving history that is sleeping at 8 p.m. All are sleeping at midnight and they want to get up at 4 a.m. So that is not proper for good health. Then watching the TV, mobile, computer late night leading to delayed release of melatonin. Now there is spelling mistake, sorry. Melatonin is a hormone from the brain which makes you sleep. So that is delayed because of the light exposure of the eyes to the eyes. Then the consequences of the sleep deprivation and obstructive sleep apnea is daytime sleepiness, tiredness. They cannot perform well. They cannot give 100% output. Many patients cannot get, many of them may not get the promotion and may not get the appreciation from his boss. They may get high blood pressure, diabetes, heart problems, increased appetite and excessive eating, the junk food also leading to obesity, hyperacidity, and abnormal behavior. Next one. Now, optimizing modern lifestyle for positive health. How we can achieve this? How, with the existing infrastructure, how best we can go in for a positive health? That is the question. Next one, sir. In Bhagavad Gita, it is mentioned that yoga is the healer for subjects who are moderate in eating, recreation, moderate in exercise, and in moderate in sleep. So you must have everything as moderate. So this is important because exercise is different from exertion. If you are walking to the railway station to catch a train, that is exertion because there is a stress to catch the train. Exercise is a planned procedure and is done in a relaxed atmosphere. So many patients say that I walk to the station. Is it an exercise? No, it may not be an exercise. Next one. Now the diet should be balanced. Regular times of eating, late night eating can lead to poor insulin secretion and rise in blood sugar. Ideal time to eat dinner is before 8 p.m. and sleep by 10 p.m. But these ideals are difficult to achieve, particularly in our own life as doctors. I have to take food at 12 midnight, 1 o'clock because of my duties. So these things we may not be able to achieve. Then eat slowly with good mastication. And those who have sleep deprivation, they eat very fast. I have diagnosed patients eating in restaurants when they eat very fast. Then, as per our Indian tradition, it is written that you should eat half of stomach, 1/4 with water and 1/4 empty for proper digestion. This is not possible when you go for a buffet lunch or dinner where you are attracted to the food and you may eat to your full stomach. Next one, please. Now, when we talk of buffet in our traditional Indian food, we used to eat at the ground level, sit at the ground, and food is being served by the server, and eating is monitored and prevents overeating and also wastage. Whereas in buffet eating, we can talk while eating, disturbed eating, dyspepsia, indigestion, overeating, fast eating, and wastage. So our traditional Indian food sitting on the ground is considered one of the best. Now, how to cultivate happiness? Be grateful for what you have. That is first thing we must be grateful. Thoda hai, thode ki jarurat hai. Feed your brain with positive thoughts. Learn the art how to forgive. Forgiveness is emptying a toxic part of your mind. So this is very difficult when somebody has insulted you. You may not like to forgive him. It is hanging around in your brain, and that might also result in the sympathetic stimulation and release of stress hormones. Remember only good things to rewire your brain for positivity. Exercise is also good because it helps to give good health. Next one, please. You prioritize your work and plan your time. So this is also very important. Detect the distractions what you have. Identify and control the Gemelberg force that distracts the person. You have to find out the forces which can distract. Find your rhythm. Be an automatic pilot of the brain. Don't waste time. Avoid screen sucking. Go on the seeing the mobile and the internet. You may not be interested, but you're just going on like that. And please avoid multitasking. You must know where to say no and slow down in your work. You create a positive environment, help and guide people if possible. Go for regular medical checkups. This is important because people take health for granted. And if you have a new car, you go for the regular servicing. But how many people go for regular medical checkups? This is also a machine, and we need to do the servicing. You must have faith in the doctor and always consult a doctor whom you have faith. Don't guide the doctor with information you have. I have patients who come with internet knowledge. Internet doesn't give knowledge, it gives information, and they try to overcome my advice by giving me some information which you may not like. The sleep hygiene is very important. You must keep the bedroom sleep friendly, mosquito and insect free. You must avoid arguments before going to sleep because that will excite the emotions. Go to sleep nearly 2 hours after dinner. Go to sleep at the same time every night if possible. Don't plan the next day while going to sleep. Avoid coffee, tea after 5 p.m. Many people they plan the next day while going to sleep. That excites the brain and it may delay the sleep. Avoid daytime napping and avoid watching TV mobile after 10 p.m. So these are the small tips for good sleep. Then posture while sleeping, we must sleep on the back, not on the side or on the prone. If you sleep on the back, the body chakras are in alignment and this helps to give you good health. So those persons who cannot sleep on the back, it may be because of the airway, the upper airway and the tongue is large and they obstruct the airway while breathing. So they may go on side. This is one of the symptoms of sleep apnea. So if you use a machine called the CPAP in these patients, they can sleep supine and get good health. That is the way to treat these patients. Now, as regards the sleep and meditation, I wrote these two lines in US conference that sleep is possibly unconscious meditation and meditation is possibly conscious sleep. This you will have to, when you go home, you can possibly think over and you can analyze it yourself. Next one, please. Life gets a lot easier when we stop expecting apple juice from oranges. I think Dr. Bholanath sent this as a morning whisper few days ago. I just took it from there. Thank you, Bholanath ji, for this. We should not expect apple juice from oranges. And thank you for your kind attention. And I would be most happy to answer any questions. Thank you, sir.
Thank you, Dr. Ramnathan. That was a different kind of a presentation, but the most needed for each one of us in this forum. What I would suggest is your presentation is comprehensive and illustrative, okay, and I would say enlightening. So, Professor Bolanath can actually take out this video of yours and circulate to all MTC members because it
Yes,
is not
sir.
only the 50 people present over here who should benefit, all the members will benefit, okay, because that is the main topic. Health is wealth, and without health, we cannot proceed and do anything. So that is what, because if I try to summarize, then that will be another seminar for me. Okay. It will be another webinar, okay, for that matter. But what you said is moderation in everything, Sattvic Guna. Okay. I think that is a message. As we age, let's do everything but in moderation. And that's going to make a big difference. And people take exercise easy. Okay. It should not be. We must exercise. Okay. We must eat on time. We must sleep on time. And it's Sattvic Guna. And godliness, I think that is also an individual aspect. Okay. Thank you very much. Absolutely wonderful.